Welcome back to Doing Life Radio. I'm Sam.
And I'm Joyce. We're a married couple living in South Jersey, talking about all things life with a special focus on food, fitness, and faith.
And today is a little bit of an outlier on all that. I mean, it can kind of, I guess,
kind of fit into the fitness. I mean, if you want to be real stretchy about it.
I mean, I like
we may be reaching a bit.
You're going to find out what's going on there. I like cold drinks when I work out, so yeah. So we're talking about, we actually have a master cool sculptor. Now, if I would do a business card, I would just stop there. It'd be master cool, and then at the bottom,
tiny little words,
tiny little
sculptor.
print, sculptor.
Yeah.
So we have our fourth guest coming in and sharing with us about Cool Sculpting. And if you have no idea what it is, then you are exactly where I was at about a half hour ago.
Yeah.
So we're going to spend time on that. Again, Instagram, Facebook, all these wonderful things. Like, share, iTunes, Spotify, Google Play, wherever you get your podcasts, we're there. Please rate and review.
Or YouTube. It
helps other people find us and be able to watch and join the conversation. We're making assumptions, assuming they're going to enjoy this.
I mean, we hope.
We'd like to think so. All right, well, let's get on with the podcast. All right, so to go right along with the way we talked about our last guest, this would be our very fourth guest.
Our very fourth guest.
Fourth guest. And this one, if you're watching on YouTube, this individual should look a little similar to, one of our actual regular hosts, which happens to be Joyce. So why don't you introduce her?
Yeah, so today we have my baby sister, Stephanie, with us. And as you know, Steph, we like to talk about food, fitness, and faith. But today we're going to go a little bit of a different direction. Stephanie happens to have her master's in public health and nutrition, so she's no stranger to the food, fitness, and faith segment. Yeah. But she also does like weight loss coaching at her job. She's a master esthetician, so lots of skincare. And you're a master in cool sculpting, right?
Yes, I am.
So that's really what we want to talk about. So instead of talking like the fitness route, maybe we're going to talk more an aesthetic route, or I don't want to say a cheating route, but a different route than maybe just watching what you eat and exercising. Fair?
Absolutely fair.
Because she spends all her days talking to people about food and all that kind of stuff, and this is just another part of your, cool sculpting. I think we have to go back to the basics. And what is it? Because I know there's a bunch of people out there going,
let's start there. What are we even talking about?
Is cool sculpting?
Cool sculpting is it's an FDA cleared non-invasive way to destroy fat cells, so you permanently get rid of fat. It's awesome.
Yeah.
It's non-invasive. It doesn't hurt. It's very easy. We can go into that a little bit more as we go through.
Yeah. I'll preface by saying, just so everyone knows, I have done cool sculpting, but I've only done it once. So what do you think about that? Is that something you can just do once, or is that something that you really need to do on a more regular basis?
Absolutely. You can do it just once as a one and done. Every time you get treated with cool sculpting, you get 20 to 25% fat reduction in the area that you treat. So you do have remaining fat cells that can still grow or that you might not want there. So you can retreat and get closer to a 50% fat reduction. I usually recommend that for the abdomen area because it's the trunk of our body. It's the thickest part of our body. So most people want to slim that down the most.
They got the most junk in our trunk.
So that is something that a lot of people do twice. Maybe occasionally I've done an abdomen a third time, but usually twice.
So after that, let's say you do it 2 to 3 times, is there a maintenance? Like, okay, now I'll see you in a year or 2 years, or really that's about it?
That's it. Yep, it's permanent. So it's an alternative route to liposuction, so you can do it non-surgical. Mm-hmm. So it does the exact same thing. We are permanently destroying fat cells. Fat cells are unique in the body because they don't regenerate. So when we're gaining weight...
Well, you haven't seen what I eat.
Well, when you eat and you eat poorly or maybe just too much, even if it's good food, the fat cells you have will actually expand because they're storage. And then as we lose weight, they contract because they're using up the energy. But the quantity stays the same.
So the amount of fat cells you're born with is the amount of fat cells you die with?
So it is genetic. Usually we're not necessarily born with that quantity. It's something that accumulates about adolescence when our body's going through those changes. Mm-hmm. So that's when we kind of hit our full fat capacity.
Okay.
And yes, we have the same amount of fat cells for the rest of our life without a procedure like this.
So we just need to find a way to put our fat cells on a diet, and apparently Cool Sculpting is a way to do it.
But that's fascinating because we
I'm
see
blown
people
away
all
now.
the time who go from like 300 pounds down to like 150 pounds. So really, they're not losing their fat cells unless they've had a procedure. They are shrinking them.
Correct.
Interesting.
This is pretty, so there's a bunch of little balloons in our body. It's a matter of if it's filled out or thinned out. That's crazy.
Yep.
That would explain
already
why
learned
your
something
skin
new.
looks so like shriveled when you lose weight. You know what I
Because
mean?
of the balloon analogy.
I do think they're two different things.
Oh,
but
okay. 'Cause, after I had a baby, my stomach is not smooth by any means anymore. It's very textured. So,
Right. And because it was stretched out.
right.
So yes, I guess because the fat cells did grow and stretch out, but that stretched out your skin. So they're two different
Gotcha.
biologies, I guess.
Okay, so tell us what someone can expect when they walk in to have this procedure done. Like, what exactly are you doing it? Because it's kind of freaky.
Yeah.
Well, when you don't know what to expect,
Well, where do you
you're
go?
going to be
Let's
nervous.
Start. Where would you go for something like this? Like that's.
So you have to be supervised by a doctor. So a lot of doctor offices will have it.
Okay.
My doctor is a general practitioner, and he owns a general practice and an aesthetics practice. So we have Cool Sculpting in our aesthetics office.
Okay.
And then if you, first and foremost, it's a customized treatment. So you would start with an assessment. So you would come in for a free assessment so we can talk to you about the procedure, talk to you about expectations with your body type and what that would look like. But at the point of the actual appointment, you just want to come in comfortable. We're not going to have you wear anything specific because we're going to give you some disposable shorts to wear. Yeah, they're very fashionable.
fancy.
Disposable shorts.
A lot of people want to take them home and show them off. Sometimes, depending on the body area, we'll have a disposable bra. So basically, we just want you to not worry about what you're wearing. That also allows consistency with pictures. That's how we track progress.
Oh, okay.
Cool Sculpting will not result in weight loss, so we can't take someone's weight and necessarily see the results. I had a gentleman gain 30 pounds between his treatment and his results, and he still showed results because it's not anything to do with your weight.
Gotcha. Was he hitting the gym or something like that? Was it like? Or
Nope.
He
He's
was
just having a
hitting-
poor
He was-
diet.
Hitting the pies.
He said, "It's summertime. I'm drinking my beer. Okay, whatever you're happy with."
He's doing a different kind of cool stuff.
So he's spending a fortune to have his body looking a certain way, but then he's not taking the internal
So this
work seriously?
specific
Like, is that a
gentleman,
typical thing?
no, that's not typical.
Okay.
This gentleman, he gains weight every summer and loses it in the fall when he's
Okay.
not.
That's backwards. Aren't we supposed to get her like our
He
summer
wants to
vibes
drink
worked
his
out?
beer.
I
Look,
love it.
I don't even
So
remember
he
his
fishes.
name, but
I know
yes.
I don't know who this guy is, but I know he fishes.
He fishes.
So with him, when he gained weight, it was very circular.
Mm-hmm.
So I treated his flanks where the love handles.
Yeah.
And so he was just so thrilled that when he gained weight, he didn't gain it as much in his love handles because he had less fat cells or storage there. He had more in his abdomen.
Why are you staring at me, Joyce?
Stop it. Okay, so tell us what you do. Like, how does it? Tell him
The
about like
procedure?
sucking it in and the ice and all that stuff.
Oh my.
Okay. So after you get changed and we take your pictures for your, marking your progress.
That was the worst part of the whole thing is her taking pictures of my fat. Just FYI. But go ahead.
It is a vulnerable experience.
Very vulnerable. And she's my sister, and I was humiliated.
No, no need to be humiliated at all. Strike that from the record.
There's not like a secret hallway where you guys saying all the befores. and-
Absolutely not.
go through.
We have to take pictures, but we would never release pictures without anyone's consent. And usually people are like, as long as my face isn't in it, I'm okay. And we're okay with that too. But anyway, we do mark the body with a permanent marker just so the treatment plan doesn't change. Depending on the area of the body, sometimes we need you to be laying down when we put the applicator on. Sometimes you need to be standing up. So the marking just allows things not to change as the body's moving. But we do have a really comfortable setup. You're going to be on a nice, comfortable bed with pillows and blankets. We give you Netflix. You can snack. You can sleep. A lot of women are like, I just can sit here and do nothing.
Like, wait a second. I can only get 2
The biggest
seconds?
surprise to me was that you can eat while you're killing my fat
What?
cells. We literally ordered pizza and ate.
This was before she was
keto. we literally sat there and ate pizza together.
And Sam,
while
she was so thrilled she could order whatever she wanted without having to consent with you.
Yeah, because he's so picky. I don't remember what kind of
like
pizza we got, but I'm sure it was something you would have hated.
Oh, you probably had fruit on or something like that, like pineapple
fruit or mushrooms or
ham
something.
Or mushrooms, all that.
I just remember you were very happy. You were happy that I was like, oh, whatever you want. Yes. More veggies, the better.
I don't always get that response.
Veggies.
Okay, so yes, you decide what you're going to eat. You're going to decide how you're going to relax, and then.
So then, once you are comfortable, we prep the skin. So we use what they call a skin prep, and it has actually like an antifreeze ingredient in it, because we want to keep the skin protected. Okay. Now, with Cool Sculpting, we're trying to get the fat to be negative 11 degrees Celsius. Ooh. Now, the skin can tolerate that because it's primarily water, and for the short period of time, it's not going to cause any skin damage. But we do want to take proper precautions anyway. So we use that little skin prep. We use a gel pad as a second protection. That is going to be a little sticky and cold, so that's why the disposable clothes are nice. But the part that Joyce has been anxiously waiting for me to get to.
Yeah, I can't even.
There's different size applicators for different parts of the body. Most applicators are generally about the size of your hand. And so we would, take the area that we're treating, and we make sure that we place the applicator on that treatment area, and it has a suction. So it will kind of massagingly suction the skin and draw that tissue away from the body, because the body will try to reheat the fat. So we need to get it away from the body. So then we can secure it. We try to secure it comfortably. The most popular thing we use is a boppy. I'm sure moms are familiar with that. So that kind of cradles it.
Is that little thing
that you would hold the baby on when you nurse? Yeah.
Yeah, like a little horseshoe shape? Okay.
Yep. So it just holds the applicator in place, so you don't have to worry about it. And once that's comfortably on you, we turn on the cold. And first 5 to 10 minutes, it gets very cold.
Yes, it does. Cold. It does get cold.
Oh my.
Best way to describe it is when you kind of are trying to fish through a cooler for a certain beverage, and your hand is in the ice for a long time, and then you go numb, because that's what happens with cold. So it's very comfortable.
That I don't really remember that being anything that was a problem.
Oh, and you are hypersensitive to cold, so if that was...
A little bit, yeah.
If that was going to be a problem, we definitely would have known about it.
So the part that kind of freaked me out was when you took it off.
Yes, that's the hardest part, and I always tell patients that's the hardest part. So now envision taking your hand out of that ice cooler, and it's getting warm.
Right.
But I have to do a 2-minute massage. So now your hand is a little uncomfortable and kind of crampy, and I'm massaging it for 2 minutes.
Bringing like the heat and the blood flow back to it? Is that what it is?
Maybe not everyone feels this way, but I felt like there's an icicle, a huge brick icicle in my stomach right now that Stephanie's trying to work out, so I no longer have a brick of ice in my stomach. I mean, it's a little freaky, right?
She has a good imagination.
Tell me about it.
It's not that dramatic, is that what you're saying?
I've had no one come off the table, so that's a good thing. So anyway, it is, so Cool Sculpting has a lot of different advances, and I actually was using a new technology on you. So the older technologies, they were a lot more like that stick of butter, it almost looked like.
Yeah.
Okay.
This one is not quite as dramatic as that, but yes, your skin and fat are very, very cold, and they're kind of stuck in that applicator shape. Huh. And then the massage, yes, it does help kind of warm it up and get some blood flow. But there's a few theories as to why it works. We're not 100% sure why it works, but it does improve the results by 67%.
By doing the massage.
By doing the massage versus not doing the massage and just Cool Sculpting on its own.
Maybe because all the little cells are running like, get away, get away, get away, get away. It's cold up there. They're probably telling all their buddies to stay away. That's probably what's happening. Oh my goodness. So only way I can envision this without actually showing a picture. Maybe we'll have to. Is there anything online that shows pictures?
Yeah, absolutely find some
images. So we'll definitely have to tag some images with it. But I figure like a suction. There's a suction happening there, like grabbing onto it. Mm-hmm. You said it's pulling. So you're pulling your flesh and the fat away from
the body, very gently.
I understand. I'm dramatic. I'm thinking like cartoon version. It's like 3 feet extended away while you're eating your pizza. Your skin is just dangling off.
You've got now a new shelf on your for your pizza.
They put the body there so you don't see the distorted skin. But I mean, in layman's terms, you're pulling it away. You're like, is the freezing? Is it killing off these cells? What's happening?
Yep.
That's exactly
the fancy terminology is apoptosis.
Apoptosis. That's actually a fun name.
It is fun.
So it is a form of lipolysis. Again, just throw something else out there. But just like liposuction, but liposuction is doing it surgically. So liposuction is going in, and it's actually cutting the skin to get to the fat cells and to draw them out.
They literally suction that out.
They literally suction it out. So this is freezing them, and fat cells, so it actually goes down, interestingly, to a handful of doctors who found some anomalies with patients and cold.
Okay.
So the most notable is a doctor who had a patient who formed dimples because it was a young patient. They were having obsessive popsicle consumption. I don't know where their parents were.
Okay.
So they were having a lot of popsicles, and the popsicle would just sit inside their mouth and their cheek, and dimples would form, which are usually genetic.
Okay.
So it was just something the doctor was like, well, that's odd. Wrote a little report on it. Didn't think much more about it. Harvard started to pick up a handful of these different research things that doctors were finding and said, well, let's look into this. Is there a correlation with cold and fat? And as a weight loss coach, I also know that there is different types of fat in our body. So there is a form of fat called brown fat. And brown fat's actually very desirable because it helps to keep your body fat under control. And it thrives in cold. Now, this is not something that Cool Sculpting has necessarily put together. I just have, with my two worlds, put them together.
You're master of two worlds.
Well, they say when you do cold therapy, it's to, accumulate more brown body fat in your body. So it makes sense.
Yeah. I mean, and at the end of the day, the fat they found, if you can get it to the correct temperature for the correct period of time, it will die off. And then the body will just process it out like any other cell that would normally die, like our organs and our skin and our blood that dies off. We just process it out of the body. It's just not typical for fat to do that.
So we're killing off the white fat? Is that what?
Brown fat can still be treated, but generally those are going to be areas more around the rib cage that aren't as thick anyway.
All the Cool Sculpting came essentially from a little kid eating popsicles.
Sucking on popsicles.
That's crazy.
He's a hero.
Yeah.
Someone right now is
listening. A cute little dimpled hero.
Someone out there right now is thinking, I always wanted the dimple. The ice
Go
cream
buy some popsicles.
You're sucking on ice or frozen
Popsicles.
Water. What is it called? Ice.
Popsicles, ice, and frozen
for the rest of my life. So I
one person with a white lab coat in the room, and it totally throws us into like a far spectrum of what we know.
What is the substance that you freeze?
Water hard, not warm.
Okay, so obviously I would assume that the abdomen is the most commonly requested area to be cool sculpted, but is there areas that can and can't be, or what's kind of popular to do? What are you finding?
So we are FDA cleared for any pocket of fat from chin to knees.
Okay. Oh, can you do your chin?
You can do your chin.
Fascinating.
Yes.
You're talking about chin, like the underneath part right there?
Yep.
With like the 2 or 3 extra ones show up?
Yep.
Like the little goal.
Absolutely. Yep. Great results because it's a small little area. And that area is solely genetic. So you can't really exercise that one off. It's really helped a lot of people with their self-image just because you can't hide that even with clothes. Men maybe with a beard, but
turtleneck. Really fluffy turtleneck.
Yep. So any pocket of fat from chin to knees, the main thing is that it has to be subcutaneous fat, meaning we have to be able to squeeze it. So if it's under the muscle and we can't squeeze it, the cold will not penetrate past the muscle.
Gotcha.
So let's say someone comes in and they've got like that classic beer belly where their stomach is like hard as a brick. You know what I'm talking about?
Yep.
They're not a candidate even though they have a big old belly.
Candidate. Nope.
Interesting. So what is the difference between someone having that kind of fat and me having the fat that you could suck right on it?
So they're just two different types of fat. So fat under the muscle is called visceral fat, and it's generally pretty easy to handle with diet.
Okay.
So that is something that is usually because someone had poor diet, and if they change their diet, they can get that under control.
Okay.
Subcutaneous fat is over the muscle, and that one is the hardest. And that's where people, And that's where Cool Sculpting is really neat, even in the fitness community, because you can lose weight, you can practice really healthy lifestyles, but that's just really, really resistant. And you could do a lot of weight training, and that's really what I find that helps it the most is, using a lot of resistant training.
Yeah.
But in order to get the body image that you may want, might actually put you unhealthy on the opposite end of the spectrum, because then you have to really get your body fat percentage very, very low, train really hard for long hours, really restrictive on your diet. And so Cool Sculpting allows you to not have to go to that unhealthy end of the spectrum, but still treat that difficult fat.
Huh. Kind of like jump the line a little bit and all that.
Is that fat more genetic, or because you said one is from a poor diet, is the other one also from a poor diet? It just lives in your body differently, or some people are just more genetically prone to having kind of a fatty
I'm
abdomen?
sure it's a little of both, but
Okay.
I'm not 100% sure as to why.
That's
Interesting.
no, it definitely is interesting because I'm thinking through like where I'm at right now and everything, and I feel like I'm doing 90% of everything like the right way, but there are definitely like certain areas like I don't even know how to address this. I don't even know how to like shake this fat off or anything like that, or run harder, run longer, run faster, eat less. Like there's so, and like you said, there's only so much extremes I want to go to
Right.
on the healthy level, and I'm not totally obsessed with my image, but you get to a certain point where you're like, wait a second, I've been working out, I've been doing this thing for so why aren't I seeing some results on this? So I guess that's where people start to be like, okay, well maybe I need lipo, and then they say, well I don't want to do lipo, so they're looking for alternatives to lipo, and I'm guessing
Cool Sculpting's
Cool
the
Sculpting
way to
pops
go.
up right up at the top.
Yep.
So
might
are
have to do a
you
field
getting
trip.
a lot of men doing Cool Sculpting, or is it mostly women?
We do get quite a lot of men. It's still in the aesthetic business, so that is very high women population.
Yeah.
But of all of the aesthetic services, Cool Sculpting has the highest percentage that we treat men. So,
Really?
Yeah,
Absolutely.
they're vain too.
yep.
It's not just us.
Men.
And if a man is going to do a aesthetic procedure, they really don't. They want to lay low with it, and Cool Sculpting gives them that option because there's no downtime.
That's
so
true. I guess you're right back at it, right?
you can
in
go to
theory.
the gym the same day. I mean, you might be tender, so you
All
might not
right,
want
so
to.
I'm gonna let you know how I made out with it. There's no way I could have gone to the gym that day personally. Now maybe some people can, but I was really surprisingly swollen. Like I couldn't even button my jeans.
I remember that.
And I was really like, oh my gosh, what have I done? Blah, blah, blah. And it was probably several days before I could wear my jeans again.
You wore
But
jeans the next day.
I don't know. I think I wore sweatpants.
I remember you saying, "Oh, I can put my jeans on today before
I
you
don't
left."
know. But I remember once the swelling reduced, I was like, oh yeah, like this was definitely worthwhile. Like it was nice. But yeah, I would never have been able to make it to the gym that first day. Now, I'm guessing different people react
people
differently.
probably,
Like some people probably do get a good amount of swelling. Some people probably don't see any swelling at all, just like with any procedure. Like people were really freaking me out about having my wisdom teeth out, and I was fine. I was at the movies that night. I never got that chickmunk face. I mean, I was like nothing happened. So probably the same thing. Some people really react, aggressively, and other people not so much. But for me, I was surprised. I was in pain. I was swollen, but it didn't last long. And then I was very pleased with the results, I would say.
Yeah. Swelling is not uncommon, a little bit of tenderness. And again, that depends on the pain spectrum. But the most common side effect is the numbing sensation you had during the treatment will last after the treatment for 3 or 4 weeks. So that's just odd. You might have an itch you can't satisfy, something like that.
I was just going to say, for about at least a week, I would feel a little like flutters in my stomach. So I wonder if that's what it was.
Maybe.
Yeah, I don't know. And that kind of freaked me out too, but then it went away. So I guess it's all normal.
Yep. We've done research. So this has had over 100 peer-reviewed studies showing it's safe and effective. No technology I've ever worked with has had that much research that is non-biased. And then it also, that's important.
Well,
Yeah,
yeah, a
no,
lot
that's
of
huge.
the
Yeah, you
food
don't-
we eat, you see all these positive studies on how it's going to help you be healthy, and then you look and you're like, oh, Kellogg's did this study. No wonder they say to eat cereal, and that's the most important breakfast of the day.
Right.
So no, it does have to be a very unbiased study. I agree.
Absolutely. And so it's safe. They've done research because people got very nervous about that numb sensation. And so they've done the research to show it's not nerve damage. It's just how the skin responds for a few weeks until it kind of all self-regulates.
That's so. Just the concept. Like
Yeah.
you can just these guys that you've lived with since your adolescence, these fat buddies.
He's very attached to his fat buddies.
And then she's going to be like, hey.
They've not done you well.
Come here, guys.
Not you specifically.
We're coming out swinging.
As a general rule.
But then they just go away. Like, I want to. Do you know the progression of the science and the application of it? Because you're talking about a machine or something like that pulls away and then freezes. I gotta imagine that early in the process, it was like, how do we get underneath the skin to freeze it? Like, do you know the progression of this? Like, kind of.
I know that the machine has had different applicators that they have continued to improve upon. I was not working with that technology. Right. I know that we looked into it a little bit. They called them parallel plates. Okay. There was one that we had that was very similar to that when we first got the machine, because the new applicator was on its way. And that one did give that kind of stick of butter to really get the pull the way that we needed it to. This one, it's more like a cup. So it's very gentle. We're not pulling it nearly as far, but the cup is able to get that circumferential cold the way we need to. So I don't know all the science, but it's interesting.
You know what you need to know. That's amazing. Now, I'm going to go out on a limb and say 95% of people go for their gut. Is that pretty accurate?
I don't know the number, but
the
yes,
actual percentage.
I would say probably at least 70% of my patients.
I can't shake this. What's next?
Lower abs, specifically, especially women post children, especially if they had a cesarean. It's a tough area.
And you're saying 2 sessions tops, really, and it pretty much tones it out?
I think I've had one patient do 3 on her abdomen, and she started off not necessarily practicing a healthy lifestyle.
Okay.
So this was her jump start. And that's another cool thing, is a lot of people think, like you mentioned, like, is it cheating? And when I first entered into the Cool Sculpting world as a health coach, that's my thought. I was like, oh, it's kind of cheating. But it actually really motivates people to start practicing healthy habits, because they're like, oh, I'm seeing my body change. So it does the reverse.
Yeah, you don't want to.
It is true. When you see results, nothing motivates you better than seeing results.
And that's what I'm saying. Like, even like me, I'm at that point now where I'm like, I need to see the next edge, of the workout and stuff like that. And I'm trying to explore different things to do. You know, we're exploring CrossFit, which we'll talk about in upcoming
but
episodes.
Seeing results is harder the further along
correct
you get.
Correct.
I can't
so
remember
that's why I see
who
this as
said
kind
it.
of being like a little, all right, like
a little pick me up.
Yeah.
Our favorite quote, and maybe you'll remember who says it. Somebody said, maintaining your weight after drastic weight loss is like running a marathon and never getting anywhere, because you still have to do all the work.
Right.
But the progress is kind of,
I like that.
Stop
Steal
coming,
it.
everything like that. Like
Right.
Now you're back to the norm, and everyone just sees you for who you are now. They don't see
all the work that goes into it.
Everything you put into it. So I could definitely see how this would be something on a personal level. You're like, okay, I've done what I can in this area. I need this little extra kick in the pants, and then you're going to continue the work to maintain, what's going on in the process and everything like that.
So obviously you would have to start with a consultation. You can't just walk in and get cool sculpting. I would, suggest going to the best that you can in your area, doing the most research you can. But you said
the ice truck guy.
Maybe not. If you're really broke, I don't know.
I'm seeing a lot of people just taking just some hardcore ice baths.
People are going to be bathing in ice, which isn't a bad thing.
That's actually a good thing too. That's a whole other topic.
Yeah, one day we're going to do a biohacking. We're working on that biohacking episode where we talk about doing some crazy things like that and what the reasons are.
Biological hacking. It has nothing to do with terroristic acts, in case the government's listening to us.
They're not. Okay, but you said that you are a master cool sculptor. So are there people who do cool sculpting that are not masters? Like, what's going on there?
So with Cool Sculpting, I love this company. They have done so much to make sure that their technicians know what they're doing, because you can cool sculpt someone poorly. We call it a shark bite, basically envisioning like I took too much fat away from an area and now you see a divot.
I guess it makes sense.
Oh my gosh.
It all started with the
dimple.
Dimple.
So yeah, I guess wow. Ugh.
So they will have someone come to your office to train you. They require you to get Cool Sculpting so you can experience it. They want you to practice on your staff. So if you're going to shark bite anyone, it's your coworkers.
People who don't like you anyway.
And then you have to do online to understand the technology. So they make sure that you are trained. and that is what you do as your foundation. They also have Cool Sculpting University. So they used to only have one location. I know they have two. They may have a third. So they have one in Reston, Virginia, which isn't too far from me, luckily. And so our office, I love my doctor. He really wants to make sure that we are up to date on all training and certification. So when there was an opportunity to go, it was just we had to do that. So I work with a coworker named Karen. We both did Cool Sculpting University twice. You really only need to do it once. It's the same thing to do it twice. But we just wanted to continue to refresh because you don't know what you don't know.
It's a lot of information to take in. So when you do it the second time, you can really absorb it.
But then Cool Sculpting Masters, this is a relatively new program. So they realized that, like when we went the second time, we were working with offices who just got the machine. So we wanted to advance, and they were basically just kind of
getting started.
Yeah, we all kind of self-assess each other, and they're like pinching us, and we're like, no, you can just grab my fat. That's okay. So
that's got to be the worst lunchroom to be a part of. Like, just all these nutrition people, and then they're coming, hey, you want to get on the machine?
Do you want to grab my fat?
Oh yeah, my husband. I'm always like, oh, I could go. He's like, stop assessing me.
Like when your
poor guy,
your spouse takes a psychology class or something like that. That's got to be the worst. He just got a little pizza just sitting there, and she comes walking in. I learned something new today.
So this new program was for that advanced training, where they really give you unique body types, people maybe with scars you have to work around, people that are not just the typical person that you would normally see in your office, but you still want to be able to cool sculpt well, and just more knowledge on the technology and things that you should expect with it. So they offered Cool Sculpting Masters, but it just I guess it's fortunate, it's in high demand. And so they really had to create a system where we could get people in that need to be in without it just kind of tumbling over. So you have to actually be invited to go based off the success of your clinic.
Wow.
So we were really honored to be able to be invited to do that. And
is that where you got the white coat?
That's where I got the white coat.
Nice. So yeah, great. I would certainly, I mean, I'm lucky enough that my sister is already a Cool Sculpting master, so I don't have to shop around. But I mean, I guess you would probably call around, right? And just say, do you have a Cool Sculpting master?
Yeah. And so, I mean, we try to
when
credential
you shop
ourselves.
For a tattoo, you don't just go to anybody. You check them out.
Yeah, you want to look at references. You want to see, you want to ask around. To see
right, you don't want to be the first paying client on the bed.
No one wants to be the first one in.
Right.
That's true.
Somebody's got to be, but you don't want...
You want to be Shark Bite Jones.
So we try to credential ourselves, and we have, honestly, in our facility, we have 2 competitors within walking distance of us.
Yeah.
And we've done the most Cool Sculpting. We weren't the first to bring it in town, but we've done the most in our facility. We've been the most successful as far as the leading office, and I think it's because we really prioritize training and those credentials.
And it sounds like you try to stay up on the technology too. Like you talked about, you've already had like a couple different phases of how you guys have done things. So with each progression, they're obviously figuring out better ways to do it. So that's probably another question to ask is, how old's your machine? Literally, like what's going on with that, and asking around, because I wouldn't even know where to start except to go online and type in Cool Sculpting and see what pops up. And then, of course, just like anything else, do your
homework,
research, do your homework on it.
And at the very least, go for a consultation. So Cool Sculpting, since it's so individualized, I don't know any office that charges for that. It's a free service, and you can really get a good feel by the environment you're in. Do you feel like it is well maintained? By the tech and the answers they have, by how they assess you. There's multiple ways to skin a cat. I've been assessed a million times because I've gone to these classes.
She's from Virginia, so she actually knows there's multiple ways to skin a cat.
So, I mean, I've had multiple technicians assess my abdomen, and I get different assessments pretty frequently, but knowing what I know, I can see where all of them can work. So there's not really a right or wrong way, but you should be able to trust that the person you're working with at least knows why they're assessing you the way they are.
And you can tell pretty quickly if you feel comfortable with somebody and if you feel like they're talking to you in a professional manner and that they really feel like they know what they're talking about. So the consultation is key, I would say.
Absolutely.
What are some realistic expectations for someone going in and getting Cool Sculpting? Like, I feel like I could probably lose a bit around, but like someone might be thinking, I'm going in,
They think they're going to change their whole physique.
Right. So what is some like realistic expectation? Are they losing halves of inches? Are they losing, size? Like, what can someone...
So the way I try to tell my patients is, I mentioned the 20 to 25% fat reduction. That's a little bit hard to envision. So I will actually, as I'm assessing them, I will grab the area of concern and I will cut it in half. And I say that's about 2 treatments. And then I cut it in half one more time and I say that's about 1 treatment.
Okay.
And that allows them to kind of see, and I can kind of pinch around, would you be happy with this or would you be happy with a little bit more?
So really the bigger the area is, the more result they will get. Like the more they have to lose, the better the result. So somebody who comes in pretty fit already is going to lose less because they have less to lose.
It will appear that way. Now they will end up getting the refinement that they're looking for.
Yeah.
So it's kind of...
So everyone's happy.
Everyone's happy.
Yeah.
That's... Okay.
So tell me about why you would say no to somebody. Because there's got to be times where they leave and they're like, you know what, no thank you. And there's got to be times they leave and you're the one saying, I'm sorry, but you're not a candidate, or at least I'm not going to do it for you.
Correct. I tell patients that probably more frequently than my boss would like to know. Because a lot of patients are looking for skin tightening. This is not going to cause any skin laxity, but it will not cause skin tightening as well. There's a little bit, so we have been FDA cleared to say that we can see skin tightening for the chin.
Oh.
So they've done the research. They can show that there's a little bit of skin tightening. It's the same technology for the body. So yes, you may get a little benefit, but not the way that most people
Not
are
enough
wanting.
that they can claim it.
Right.
Well, they've just not done the research for the body.
Okay.
Or they've not had it at least shown. So, so when someone comes in, they have massive laxity. I have to ask them first and foremost, is surgery off the table? Because if surgery is off the table, it's still a good option as long as they know we're not addressing the laxity.
Right.
But if surgery is not off the table, they may be able to get both corrected, the fat and the laxity. So we have to talk about that. Now, if someone does have a lot of tissue pushing, they may not really get laxity, but it may start to appear a little bit more. And I have a picture on the website that I'm sure I can give to you guys to show of a patient that she was so thrilled because she had a little bit of billowing under her shirt. And so this allowed it to lay flat at her rib cage. But when she had her shirt off, you can see a little bit of laxity in her skin because that billowing was pushing at her skin, and it gave it that tight look. So we talk about skin condition. We talk about expectations. What are they wanting? Is that what you're going to be getting? Of course, price. We always talk about price. So that way, because patients have no concept of price, and it's hard to know on the phone how to. We really can't go through price on the phone because everybody's abdomen or results and desires are different. But some patients might think this is a $50 procedure, and it definitely is not. So we will, go through all those different things. And so sometimes I have to tell patients, you're not the best candidate for this procedure. I have patients that want me to treat the front of their legs for cellulite. This is not a cellulite treatment. So things like that.
That's good to know. That's a good point there. So how much space can you do at one shot?
So we have 2 machines in our office. So we can do what we call dual sculpting. So we can use both machines at the same time and cut your treatment time in half.
Wow.
Which is nice. So each treatment cycle is roughly 35 to 45 minutes depending on the applicator. So if you need to do a couple cycles, as we call it, it will take you very short period of time. Some people are, hey, I just want to get it all done. And if they are wanting to do it and they're okay with the fact they might be a little bit more tender because we treated more of their body.
Right.
I've had patients there for 6 hours.
So just sit there and you'll just move the applicator around or wherever. Wow.
Yep. But then, like Joy said, we order you lunch. We have Netflix. I have patients work.
It was a wonderful time.
Yeah.
That is so bizarre. This thing's like, you're just like, all kinds of stuff. What an experience. Yeah, I'm going to look great after this.
It's always interesting. Joyce was the only one who ordered pizza, probably because she knows me. Everyone else
suggested pizza.
I probably did. I'll put myself out
Can I
there.
have some fruits?
I probably did.
Maybe some celery.
All
with
of my
this.
patients that I say will order you lunch, they're like, just order me a salad. I'm not judging. Order whatever you want.
Right.
Like, we're already here, right?
The
Oh
question
my gosh.
is, like, you got, so on one end of your body, your fat cells are like, yay, and the other ones are like,
I'm dying.
I'm in the wrong space.
Hilarious.
That's awesome.
These aren't the gut buddies we're talking about the other day, are they? That we're getting rid
No,
of?
but I would
Okay.
love to have Steph back on to talk about gut buddies.
I don't know what this is.
You're not a master of the gut buddy?
Not yet.
It sounds like it'd be a wonderful boppy that you would carry around with you all the time, but it's not. Apparently, gut buddies are internal organisms and all that stuff that are fighting the system, not your fat buddies that apparently are always with you until you kill them with Cool Sculpting.
Yeah.
Oh, poor guys.
So yeah, for the record, before anybody lets us know, we'll let you know we are not recommending anybody get any sort of procedure done, surgical or otherwise.
Oh yeah, we're not experts. We just brought the
merely
expert
putting
in.
information out
I'm an
there.
expert.
That's what I said. We
Right,
brought the
we
expert
brought
in.
an expert in. We think it's fascinating. I had it done. I would certainly have it done again, but I'm certainly not recommending that you have it done. I'm just saying this is interesting.
I like the concept, and you said you've seen it as like that extra push for someone who's like kind of making all this work, and they just need that little bit motivator, or maybe use it as motivation. When I get to a certain point in my workout routine, then
I'll get it done.
Right, I'll do that kind of deal.
If I lose X amount of pounds, I'll get it done. Like
That's where my latest
cherry
tattoo came
hanging
from.
out,
I use
yeah.
that as the carrot out there. I said, when I get to this certain point, then that's where it's going to be.
That's your
Sorry,
reward.
Mom and Dad, if you don't know about it.
Well, I can say for me, like I said, when we first got it in and they require us to be certified to have it done, I did feel, I was like, this is a little bit cheating. I tell all my patients, you can do this on your own. You don't need any of these other fancy devices. And then I also went through a period just a few years ago where I had a lot of stress in my life and I couldn't keep the weight on. So it would not have been appropriate for Cool Sculpting then. But now I'm also in a stage where I've regained the weight and I'm in a healthy place. But now I'm remembering how I looked when I was unhealthy, right? So I'm like, I obviously
get more stressed out.
obviously I don't want to put my body through that type of stress to get that end result. But you're right. I mean, I was complimented left and right, and I know in my head I'm reassuring myself like you still need to eat because you're not in a healthy place.
Yep.
But now that I'm healthier, I still want that body that everyone was complimenting. So Cool
want the best
Sculpting
of
is
both
a great way to achieve that.
Well, that's fun. Listen, I had no idea what we're getting ourselves into when we got into this.
Yeah, when
really
I told
didn't.
Sam we were going to talk about Cool Sculpting, he said, "What's Cool Sculpting?" And I gave him
And you
his
said-
favorite answer. Wait for the podcast. Then I told him I had it done, and he still looked like a deer in headlights. So
Yeah,
way to
I
listen
remember-
to me, babe.
Yeah, I remember you went away to visit your sister. Something happened, and snowstorm. So I didn't know if that was all correlated and all that kind of
Yep.
stuff. It's wonderful. Well, because to me, babe, you look great, regardless.
Thanks, honey.
See, you like that? Like how today?
Sure.
All right, so you've stuck with us this far, this long. So we're gonna have in all the show notes. We'll have ways you can reach out to Stephanie. I'm sure you're open if people have questions about it. And reach out
Absolutely.
to that. Obviously, anyone local to your area, you can definitely want to see them in your office and coming out. Cool Sculpting. We're gonna have all the hashtags, all the ads, all the tags going on in our Instagram and Facebook accounts. So you can definitely follow along there. If you have any questions you want to pass along, again, Joyce and I are not going to be able to answer them. We're just going to say it feels cold and you look great when you're all said and done. Stephanie's got all the master answers to that. She wears a white jacket to prove it. Any final notes on the way out the door?
The only thing I don't think we mentioned is it does take 3 months to see your results.
Oh, we didn't say that.
Yeah.
Yeah.
3 months to see your results. So let's see, if you got a reunion coming up, plan accordingly.
ahead.
Right. You're going to see the ex-boyfriend, plan ahead.
Right.
You gotta get
Revenge body.
And I think that's a great way to end up. Thank you.